Good morning. My name is Morgan. I'm going to be your nurse for the day. I want to take some time this morning to go over a couple questions and go ahead and assess you. I'd like to start off by confirming what's your name, date of birth, and what year it is. Hi, my name is Sarah Smith. My date of birth is 9/11/93, and this year is 2020. Perfect. I see here that you came to the emergency room yesterday because you were experiencing some sickle cell pain in your legs. Is that correct? Yes, that's unfortunately correct. I started to experience some pain in my legs specifically about 4 or 5 days ago, and I just couldn't get my pain under control. So I decided to come to the emergency room to see if they could help me with some pain management. Speaking of your pain, if you had to rate it from a 0 to 10, 0 being absolutely no pain, 10 being the most excruciating pain you've ever been in, what would you rate your pain right now? And where is the pain located? Thanks for asking. My pain right now is in my legs, and it's about a 2, but I don't really want any medicine for that. I can usually tolerate it until the pain gets about a 6. Topic about your legs. Have you been experiencing any additional swelling, numbness, tingling, anything else? What about in your arms as well? I'm going to go ahead and do a couple tests to gauge your strength and your muscles and if they're all working okay. So can you just go ahead and squeeze my fingers real quick? Perfect. What about, can you wiggle your toes for me? Awesome. Can you pump your ankles against my feet or against my hands? Great job. These tests are super important, again, just to gauge your strength. Have you been experiencing any chest pain or difficulty breathing since you've been hospitalized? What about, have you been using that Incentus barometer I see over there on your table? It's super important that you continue to use it. That little tool helps exercise your lungs while you're laying down since you're not as active, and it keeps your lungs nice and healthy, and it ultimately prevents you from getting pneumonia. So make sure that you keep using it. How you use it is you wrap your lips around the mouthpiece and you actually breathe in a deep breath until the thing rises, and then you let it fall. You do this over and over again. I'll give you the goal of doing it about 10 times, and maybe you should try to do it 10 times about every hour. Nope, no chest pain or difficulty breathing, and I do need to get better at that Incentus barometer. So thanks for showing me. Keep up the good work on that. So I wanted to ask you, how's your home life? And how's your support system? Those are very important things that we gauge. We have a lot of sickle cell support group and information for you out there. Sure, I don't mind talking about it. I do still live with my parents. They help me out a lot, and they are such a large support system for me since I have my chronic disease. And I would like some more information about that support group. I can always use more friends going through the same thing. Hey Sarah, I'll definitely go get that information for you. Do you mind if I just take a look at your IV? I want to make sure that it's working well and it's not causing you any problems. Is it red, puffy, stinging? Oh, I think my IV's been good so far. No pain. Well, your IV looks great, and so does your tubing. I have a couple more questions for you, though. How's your stomach feeling? Have you been nauseous or vomiting? Have you been pooping and peeing regularly? I know those are awkward questions to answer, but very important. I want to make sure that you're especially pooping regularly since you're taking narcotics for your pain, and making sure that you're not constipated. And how's your pee? When was the last time you peed? Is it stinging, burning? Does the color and the odor all look normal to you? No nausea or vomiting. I haven't pooped in about 4 days though, and my pee is on the darker side. Are those things normal? Good to know. Those things are a little bit abnormal, so I'll let the doctors know, and they'll probably want to address them. We'll just keep an extra close lookout on your I's and O's. It's important that we do that to make sure that your body's getting what you need and that everything's going in and coming out okay. You just let me know the next time that you use the restroom, okay? Well, I'm all done now, so if you need anything, you just call me. And if not, I'll be back in about 30 minutes with your next pain meds, okay? Nice talking with you, Sarah. Bye.